Hi, how are you? So we're going to talk about blood pressure and blood pressure numbers and why it's important to know your number. So you can actually get your blood pressure measured for free right here in the pharmacy. Do you want to come in and I'll show you? So it's our massive consultation room. So when someone comes here, you just take a seat and we ask people to sit for a couple of minutes because your blood pressure can often be elevated when you first come in because maybe you've had a lot of coffee, maybe you've gone for a walk, you're stressed when you're coming in, so often your blood pressure is quite high. Because our blood pressure measurement that we're doing here is just a snapshot. It's a once in time, really quick picture. So what we would do generally, and I can demonstrate on myself, is we'll ask the person to sit. As I said, they'd be nice and quiet after a few minutes. So we get a cuff, and what we want to do is get a measurement just here. So the measurement, sit it on that vein and wrap it over, and then yeah, we do it nice and tight. So depending on the cuff, we have it here. Nice, my best job ever. And then anyway, you want to have it nice and tight. So what we're going to do is measure blood pressure when the heart pumps out all the blood, and also when it's relaxing in and all the blood is reducing. So this would give us, this measurement then will give us two different figures. That's why you're getting two numbers with your blood pressure. And that's why it's important for you to know. So they recommend that everybody over 30 gets a blood pressure measured every 5 years, and that everybody who's got any sort of history of blood pressure issues to get it measured every year. So a couple of different numbers, and this is where, as I said to you, you're getting the diastolic and systolic. So that's why we always give you two numbers. One is when the heart pumps out, and one is when it's not. It's just relaxed. And that's why you get the really high pressure on one, and you get the relaxed on the other. So by knowing your numbers, you know where you are. So it can be quite different. Some people are regularly have a lower blood pressure, and that's normally your family, and some people just normally have an elevated blood pressure. We call that hypertension. It's the elevated. So there's loads of things you can do non-pharmacologically to help with your blood pressure. That's why it's really nice to get knowledge and get to know. So often when the person comes in, it is a little bit, they're stressed, they're in a pharmacy, they don't want to be here, they're worried about the blood pressure, they might have a headache, etc. You get a higher number. So then we'll get you to actually sit and relax first. And then once you've gotten relaxed, we'll do it in your other arm as well and just check where you are. From then on, we can see there's lots we can do to manage our own blood pressure ourselves. So one is increasing water, getting exercise outside, just a bit of extra walking, all that kind of stuff, using your diet, lifestyle, looking at meditation, looking at yoga, looking at writing, journaling. Loads of different things we do actually affect our blood pressure, but it's also a great thing to manage because long term we want to look at 40, 50, 60 years because of the risk of stroke and cardiovascular issues, etc. If you get to know your numbers when you're younger, then, or even like as I said, middle age, it really helps that when you, rather than you walk into a pharmacy and get one snapshot, we don't know if that's actually very high for you or is that something that you're normally walking around with. If you are someone who suffers from high blood pressure, there's lots of actual medical things we can do to reduce your risk. So it's really helpful to get to know it early on. So as I said, here in the pharmacy, we do it all the time.